Welcome. My name is Dr. Chris Hughes. I am an implant and cosmetic dentist in Heron, Illinois, in Southern Illinois. And this is my first and premier podcast. Basically what I'd like to talk to you all about is different topics in dentistry. Since my practice is focused in implant dentistry and also cosmetic dentistry, we'll be covering a lot of topics related to that in detail, but we'll also be talking about just dental topics in general, dental health, and other things that are related to and important to the field of dentistry. So anyway, I thought we'd begin our conversation about currently what's going on in dentistry. And obviously, as you all know and have been affected by, the whole world has been affected by this terrible COVID-19 virus. And I think the first thing that everyone should know is that as far as dentistry, of course, has been at the forefront of healthcare providers practicing universal precautions. So that means the wearing of gloves and masks and sterilization of equipment that's used on patients. So really, in a sense, there hasn't been a dramatic change in dentistry because we've already been wearing masks, gloves, and goggles for procedures. There has been some things that are a little more stringent. Some dentists are wearing more of a protective face shield in addition to their masks. I've seen a few that have really kind of gone to the maximum limit where they're wearing kind of a hood with a shield, kind of almost like a hazmat suit. I haven't seen anybody wearing that around here, but I have seen that among some colleagues. But the bottom line is, first of all, is it safe to go to the dentist? And so I think everybody should know that certainly it is safe to go to the dentist, that all the dentists in the nation and probably throughout the world have not only are following the universal precautions of gloves, mask, and goggle, but have also done some additional things. So let's talk about what additional things have been done. Well, certainly there has been a question as to air quality. I know that when the virus hit, the Illinois State Dental Society started talking about additional things that can be implemented. And so certainly in dentistry, one of the biggest problems or concerns, I guess you could say, with respect to viral transmission, especially a virus that is based or grounded in the upper respiratory tract, is the generation of an aerosol. As we all know, when teeth have to be modified, rebuilt, a drill has to be used, and the drill is cooled by a spray. So the water spray hits the drill, which hits the tooth structure and creates an aerosol, and that aerosol is generated in the mouth, and then it's flushed out of the mouth, and the aerosol circulates in the air. Certainly, this is why dentists also are employing face masks in addition to, they're employing face shields or a protective cover in addition to face masks when an aerosol is generated. However, outside of the protection of the dentist and dental assistant or dental hygienist or clinical people that are in the area, this aerosol, how else can it be controlled? So many dentists are using air purifiers in their practice. Basically, I have an air purifier in every operatory or treatment room. And so what that does is any aerosol that gets, 10 to 15 feet or beyond where the treatment is being done, or where the mouth is and where the aerosol is being generated, that aerosol is then taken up into an air purifier. So that is one of the, I think, one of the important ways to control aerosol that's being generated in the dental environment. So nothing is perfect, certainly, but it was something that was never thought of, and there was actually no need for it in the past. But it is something that is being, I believe, commonly employed now in most dental practices throughout the country. Some other things that are being done in dental practices is basically limiting the flow of patients through the practice. And again, these are guidelines that have been outlined, at least in Illinois, through the Illinois State Dental Society, but have also been outlined on a national level through the American Dental Association. So anyway, limiting patient flow through the office. Well, how's that done? Well, as you know, or maybe some of you don't know yet, the virus is highly contagious, and so we need to prevent person-to-person contact whenever we can. So anyway, how this is done in the dental office, traditionally patients would come in and they would sit in a reception room, probably with, who knows, 2, 3, 4, 5, 6, even maybe 10 other people sitting around in a room, maybe, 10, 15 by 15 or 15 by 20. The chairs would be lined up and people would sit right next to each other, just like they would in any other sort of professional office, be it a medical office, veterinary office, optometry. All of them, maybe even an attorney's office, all of them pretty much have a reception or waiting room. So basically, what has occurred is waiting to be seen by the doctor in a reception room type of situation has been eliminated. And of course, that's been done to limit the amount of person-to-person proximity in a waiting room. That's been eliminated altogether. And now patients are basically waiting in their car, and then either a dental assistant or someone from the office will come out to the car and escort them not just to the waiting room, but will escort them all the way back to the operatory or treatment area. So this is obviously a big departure. Another thing that we do, of course, with the we've had cell phones around now for about 20 years, is that we can also call the patient while they're in the parking lot on their cell phone, or send them a text. And then they can come in, and then again, the dental assistant or whoever's responsible in the dental office for this would meet them at the door and then escort them to the operatory. So that's another area where we're cutting down on the possibility of transmission by limiting, in a good way, limiting patient contact between patients, obviously. Another thing that is done is that after the appointment's over, we make sure, and it's been suggested by, again, different agencies, ADA, Illinois State Dental Association, that you limit the contact of the patient at the front desk. So, for example, after a person's had their teeth cleaned or needs to pay a balance on a bill or whatever for the service. What we're doing is, number one, we're making sure that that patients don't congregate at the front desk. Number one, patients are sometimes reappointed now in the treatment rooms. And number two, patients can pay any balance on services. Basically, we don't allow people to congregate at the front desk for that for more than, say, one person at a time. If there are a number of people that need to check out, that we keep them in separate rooms, or they're kept in separate rooms so that there's no interpatient contact. So that's another great way to reduce contact among patients. So we've talked about sort of interpatient contacts. What about some other things? Well, one of probably the most important things is dentists are in that 1A group of healthcare providers that are on the list to be some of the first to be vaccinated. I personally was vaccinated about 3 weeks ago now. In my area, which is in Herrin, which is in southern Illinois, we do have a health department. It's called Bi-County Health. And I called them up and I said, I think it'd be a good idea if I got vaccinated because I am in this group. And so they said, yes, please bring your office in. And so within a day or two, I was able to get vaccinated. And I know that all my other colleagues in the area are in the process of being vaccinated. So this is another important thing to consider, is that your provider, or in this case your dentist, should be vaccinated or should be getting vaccinated very, very soon. That way, again, no matter where the dentist or the personnel, the assistant or hygienist or front desk person, and by the way, yes, everyone in the practice or office is vaccinated. So this could also mean a front desk person who doesn't do any clinical, has any clinical responsibilities or duties, but they are part of the team, and certainly they're in the office. They're exposed just like anybody else, so they are vaccinated too. As a matter of fact, an interesting little story. Anne, my front desk person and administrator, when I went to get vaccinated at Bi-County, she was actually there before me and got vaccinated before me. But anyway, the point is that vaccination of the doctor and of the other personnel in the dental office is going on currently, and it has already gone on. So you can feel good that your dental people have been vaccinated, so they're not going to get the virus and they're not going to spread it. So when you take that on top of the other precautions that are being employed, you can see that the dental office is a safe environment to go to. Okay. So a couple of other minor things that are being done, like you see pretty much almost everywhere in every business. There is a stand out when you enter the office, and certainly in my office, and I believe you'll find this in most offices, where you can clean your hands. Patients also wear masks. Obviously, all the way when they come into the office, they're wearing a mask. Actually, when they sit down, they're wearing a mask. We're all wearing our universal precautions already, so we're wearing masks already. And actually, the only time the patient takes the mask off is when we're starting to work on them. We still haven't figured out a way to work through a mask, somebody wearing a mask. but obviously that's not required. So anyway, as soon as we're done, the patient puts the mask back on. If they need to check out, they're limited at the front desk to only one person at a time. Obviously, too, when they come in, they're wearing a mask. They're wearing the mask the whole time except when they're actually receiving treatment. These are all important things to help reassure the public that actually going to the dentist is safe. Of course, there's always going to be people that are going to have reservations, and certainly we understand that. But also, it's important for people to have the facts and not to make decisions off of hearsay or rumors or things like that. They need to have solid facts that they know about. So certainly, this is going on in the vast majority of dental offices in the state and actually throughout the country. However, if you are unsure about the dentist that you're seeing, as far as if they're taking the precautions that I've talked about, certainly it would be wise to go ahead and call the dental office and ask some questions, find out what they're doing to prevent the spread of COVID-19 in the dental atmosphere in their offices, and just be candid and find out. And I'm sure that again, the vast majority of offices you're going to find are going to be employing these precautions. With that, then you have some facts at your disposal to make an intelligent decision if you feel that it is safe. And certainly what I have talked about covers pretty much everything that needs to be done in the dental office. And if those precautions that I've talked about are employed, you have a very, very safe environment. Anyway, I think that probably pretty much answers everyone's questions. Certainly, if you have any further questions and would like to talk to us personally, you can reach us at Hughes Dental Arts Center, my dental practice, which is located in the Logan Professional Park, just bordering Route 13 near the intersection of Route 13 and 148, where our address is 15 Rushing Drive, Herrin, Illinois. And we're right across from the Orthopedic Surgery Center, right there in the Logan Professional Park. And our website is hughesdentalarts.com, spelled HUGHESDENTALARTS.com. So anyway, I urge you to give our office a call if you have any further questions about the precautions that are being taken for COVID-19. So anyway, moving on to some other topics. As I've talked about, I am a general dentist, but I have quite a bit of advanced training and certification in implant dentistry. As a matter of fact, I am board certified in the discipline of implant dentistry through the American Board of Oral Implantology, Implant Dentistry. Say that real fast 5 times, right? So anyway, we have about 10 more minutes here to just kind of start scratching the surface on my favorite topic in implant dentistry. So I think we'll kind of just start with really what implant dentistry is, kind of how it's evolved into a major and important treatment modality for dentists these days. And we're just kind of going to go over the basics today. So the first question is, well, what really is implant dentistry, and who really needs implant dentistry? So it's a great question. I have people coming in all the time into my office that really are a little bit confused about what implant dentistry is and who is really designed to serve. So the first patient that I can think about that comes in is they have a full complement of teeth. They have a smile that maybe could use a little fine-tuning or upgrading or making their smile look better. But they can chew pretty good, and they're really not missing any teeth. And the first thing they'll say is, well, Dr. Hughes, I know you do implant dentistry, and, how can I make my teeth look better? I think I need some dental implants. And so, of course, I'll do an exam and evaluate them. And then when I'll have them back for the consultation, I'll say, well, Mary or whoever it is, I'll say, you don't need dental implants. And they'll say, why? And I'll say, well, because you have healthy teeth and you can chew. And I'll say, now your teeth don't look so good. There's some teeth that are discolored. You have maybe some crowding, maybe some fillings are older and need to be replaced. But overall, you have pretty healthy bone support around your teeth. And the main thing is you have teeth. And they'll kind of look at me puzzled, and I'll say, okay, well, you got to understand, okay, implant dentistry is for people that are missing teeth, okay? Actually, if we just want to make the teeth look better, we can do cosmetic dentistry techniques. We can do whitening, we can do tooth-colored fillings, we can straighten teeth with Invisalign or with conventional wire and black bracket, which I've done, all these things. So it's kind of like making the hood ornament on a car look nice, okay? But if you have a flat tire, that's a totally different thing, right? So the flat tire really kind of comes before making the hood ornament look good. So cosmetic dentistry is kind of making something look good. But implant dentistry really has to do with the replacement of teeth. So what do we mean by that? Well, let's take a simple example. If you're missing, let's say, a back tooth, a back molar, okay? When that tooth is gone, there's nothing there. The molar that you used to chew on is now not there. Okay, so how did we do that in traditional dentistry in the past? What we would do is we would make what's called a bridge. Okay, a bridge is simply where we put a crown on a tooth adjacent to where the missing tooth is, and then we fuse another tooth to that. Okay, what we do is we fuse not a tooth, but we fuse a crown in between that. And I just realized that there is a video component to this, so I should have brought a model. I'll do that next time. But basically, what's going on? I'll just try to describe this without a model. Is that we're having to put a crown on the tooth in front of the gap and a crown on the tooth behind the gap, and then we're fusing a false tooth crown basically in between those two crowns, okay, which acts as a tooth. So basically, the issue is what we're doing is if we're missing one tooth, we're actually involving three teeth to replace the one tooth, okay? Now, that may not sound like such a great idea, and it, to be honest, really is not in 2021. But back in 1989, when I graduated from dental school, that was the state of the art, which now, probably to some of you listening or watching, may sound almost ridiculous. But like I said, back at that time, back in the late 80s, early 90s, all the way even until the early 2000s, implant dentistry was not a recognized, normal, accepted treatment modality. Okay, so it's just kind of like in medicine. 150 years ago or so, they still are using. They are still letting blood to physicians were letting blood to correct different diseases, and also using leeches to also treat different problems, different diseases. And of course, that sounds crazy now, 150 years later. And in dentistry, doing a bridge now is something that's still done, but not as common as certainly as it was done 30 to even 25 to 30 years ago. So anyway, getting back to our problem. So we're missing a tooth. We talked about the bridge. You could do what they call a partial denture. That's just a false tooth attached onto kind of like an orthodontic retainer. Those are not very good. They don't last very long, and they move around. So that's not a good way. So basically, the dental implant is the replacement for the root of a tooth. Okay, so imagine, and again, I don't have a model. I'll bring a model next time. But imagine that your tooth has gum around it, right? And the gum is basically kind of like lays over the bone, sort of like carpet lays over a floor, okay? So your tooth is embedded in the gum, which is actually embedded in bone, okay? So you got tooth, you got a little bit of gum tissue, and then you've got the root of the tooth, which is embedded in bone. And of course, it's embedded in bone, so it doesn't move, okay? So what a dental implant is, the best way to understand what implant really is that it is a replacement for the root of a tooth. Okay, that's all it is. Most dental implants look like screws. They kind of look like wood screws, and so what is done is the replacement root or titanium screw is placed into the bone. It is a kind of surgical procedure. But in a way, if very simple to understand, because it's like putting basically a screw into a block of wood. And so the screw goes into the bone. Now we have the screw in the bone, so we have the replacement part of the root. So then, well, what about the tooth part? Okay, well, the tooth part actually screws into the screw. So if you can imagine, the screw in the middle of the screw has a hole, and then there's threading in there, okay? And then your tooth fits over the top of the screw, and then you put the screw into the crown, which fastens it onto the dental implant. And that's essentially what a dental implant is. So the people that come in with good, healthy teeth but aren't looking so good, they don't need dental implants because they have teeth. They don't need any roots replaced, and so anyway, they're not candidates really. However, dental implants are big for people that need to replace one tooth or a group of teeth. Or sometimes an entire dentition. In other words, they could have all their teeth in their upper or lower jaw is bad, and all the roots need to be removed, and the remaining broken down teeth. This can be replaced with dental implants. Or another example is people that haven't had teeth for a long time, and they're wearing a denture, and the denture is not moving. Is not what patients will say is not fitting well, which really they mean it's not staying in their mouth. and it's miserable because they can't chew, they can't eat. So how do they, that can be the denture secured? It can be done with a dental implant. So anyway, that is just a brief overview of implant dentistry today. We're going to go into more detail. I'm going to bring my, probably bring my models next time, and we'll go into more detail about how dental implants are done, the procedure, how they work, how they function, and how they improve patients' lives quite dramatically to be able to chew and smile for the rest of their life. So anyway, I wanted to thank you for listening today. It was a pleasure and an honor to bring this broadcast to you, and I look forward to speaking to you all next time. Again, thank you very much. Dr. Chris Hughes signing off, and we'll talk to you next time. Bye.